This is another presentation by My Weight World.
Nutrition supplements. Who needs what and why? Deciding about taking nutrition supplements can be confusing at best, and having some background information about what your body needs and why can help you make informed choices. The goal of this presentation is to give you an overview of the benefits and risks of vitamin supplements and also enlighten you to some health conditions that might affect your specific nutritional needs. Just what are vitamins and minerals anyway? Vitamins and minerals are nutrients that you must get from food that you eat because your body cannot make them. Vitamins and minerals are required through all life stages for normal growth and metabolism. However, at different times in our lives, we need different amounts based on our body size and health issues. Vitamins and minerals are referred to as micro or small nutrients since we only need them in small amounts. The macro or large nutrients include protein, carbohydrate, and fats, which provide calories burned for energy or stored as fat. Common vitamins include vitamin A, which comes from both plant and animal sources. The B vitamin group includes thiamine, riboflavin, niacin, folate or folic acid, pyridoxine, cobalamin, pantothenic acid, and biotin. Vitamin C is also known as ascorbic acid. Vitamin D is classified into two forms. Vitamin D2, known as ergocalciferol, occurs in small numbers of foods, while the body manufactures vitamin D3 or cholecalciferol in the skin when exposed to sunlight. Vitamin E is also known as tocopherol, and vitamin K is known as both phyloquinone from food and menaquinone, main in the body. Minerals, the other micronutrient group, are also known to be important for maintaining good health. Several that are required include calcium, chloride, potassium, phosphorus, magnesium, sodium, and sulfur. Additional minerals needed include chromium, cobalt, copper, fluoride, iodide, iron, manganese, molybdenum, selenium, and zinc. There are also some minerals that are still being researched regarding their roles in health. These include boron, cadmium, nickel, silicone, tin, and vanadium. Even though we only need a small amount, minerals have important roles in our health, including bone formation, tooth formation, and resistance to cavities, regulation of functions such as digestion, as well as blood and hormone production, and control of nerve and muscles. It is interesting to note that our body can make some of its own vitamins. However, this can be affected by our health status and age. Some vitamins that our body can produce in significant amounts include vitamin D when the skin is exposed to sunlight. Vitamin D is essential for bone formation and muscle strength. And niacin, one of the B vitamins, is made by our body by one of the amino acids known as tryptophan. Like other B vitamins, niacin is important for converting our food into energy as well as proper functioning of the nervous system. When considering whether to take supplements, it is always best to get your nutrients from real foods as the main source. A supplement is just that, not a substitute for a healthful diet. Also remember that besides vitamins and minerals, whole grains, beans, nuts, and vegetables provide phytochemicals and dietary fiber, which protect your body from chronic diseases and have many health benefits, including weight control. New findings in the science of health and nutrition are developing all the time. As we have seen in the past, recommendations have and will most likely continue to change as we learn more about what our bodies need for good health. However, like with many new and often passing fads and miracle cures, supplements in many different forms are for sale everywhere, from store shelves to television and the internet, often at very high expense. Beware of miracle claims, marketing hype, and testimonials. Also remember that nutrition supplements may actually interfere with medications and other health treatments. Be sure to discuss supplements that you are taking or planning to take with your healthcare providers for medical guidance. For the majority of people, a standard multivitamin mineral supplement is usually safe and effective. Look for multivitamin mineral supplements that have not much more than 100% of the recommended daily allowances for most nutrients to avoid overdoses. And do consider other sources of fortified foods and drinks that may add to the vitamin and mineral content of your diet. It can be easy to miss because the print on the labels can be so small, but several fortified foods are on the market that are very similar to vitamin and mineral supplements, including some breakfast cereals, fortified granola or energy bars, meal replacement drinks and bars, energy drinks, which typically also contain a good amount of caffeine, and more. Get in the habit of checking the labels because in many cases, more vitamins or minerals is not necessary. Generally, the most common vitamin and mineral deficiencies include iron, as in many cases, especially with women of childbearing years, needs for iron usually exceed intake from iron-rich foods, which come mostly from red meat and eggs. Other common mineral deficiencies, which also can be dependent on geographical location, include calcium, iodine, and fluoride. Because the body stores and reuses minerals, many deficiencies usually don't cause symptoms for several years. Consider the example of calcium deficiency in the diet. This is not often apparent until the senior years, when hip fractures and back problems surface due to osteoporosis, the demineralization and weakened structure of the bones. There is increasing information about the important roles of vitamin D, along with evidence for higher need for this vitamin than previously thought. Deficiency of vitamin D leads to the bone diseases including rickets and osteoporosis. Newly recognized are the links between this vitamin and diabetes, cancers, and other health conditions. Because of new scientific information, recommendations for vitamin D intake may be raised from the current RDA of 200 to 600 international units per day to 1,000 international units per day. Supplements for special health needs. People who may need additional supplements include pregnant and breastfeeding women, those who follow a low-calorie diet, and those with irregular eating habits, as well as strict vegetarians or vegans, those who are anemic, recovering from surgery, have digestive disorders or food allergies, as well as those who smoke or drink alcohol regularly. Other vitamin deficiencies that occur more commonly than others include vitamin A. Deficiency of vitamin A leads to poor wound healing, night blindness, and other eye diseases, and weaknesses in the lining and tissue integrity of our internal organs. Deficiency of vitamin C, known to cause the deficiency disease scurvy, can also cause poor wound healing, muscle weakness, joint pain, bleeding gums, and fatigue. An inadequate intake of vitamin B6 can occur in alcoholics and women who take birth control pills because of higher needs for this vitamin. Deficiency of B6 can cause symptoms such as flaky skin, nausea, poor appetite, and mental changes. Inadequate intake of B12 is more common in strict vegetarians or vegans who do not eat any animal sources of foods. Because of digestive changes, seniors, those who use antacid medicines, and those who have stomach surgery are also at risk of B12 deficiency. This deficiency may result in nerve damage and inflammation of the mouth, tongue, and gums. B12 deficiency can be treated, if needed, by injections or high-dose oral supplements under physician supervision. As a reminder of where most vitamins and minerals are found in foods, let's look at the choices that can cover most nutrient needs. Vitamin A and many essential minerals are found abundantly in dark and brightly colored fruits and vegetables. Just think bright colors, naturally occurring of course, and you have it made. Examples include bright green broccoli, deep red strawberries, dark purple red cabbage, just to name a few. Fresh, frozen, or even canned fruits and vegetables can provide many nutritional benefits. B vitamins are found abundantly in protein-rich foods such as meat, fish, chicken, and eggs, as well as nuts, beans, fortified and whole grain products. B vitamins are also found in a variety of fruits and vegetables. Vitamin C is found most often in citrus fruits, as well as many vegetables such as red and green peppers and cabbage, and in fortified juices. Yet more reasons to focus on eating those fruits and veggies. Vitamin D, in addition to being made by your skin when exposed to sunlight, is found in fish, eggs, fluid milk, and many fortified cereals. Vitamin E is also found in cereals as well as in nuts, seeds, and oils. Wheat germ is a particularly good source of vitamin E, along with many B vitamins. Vitamin K, besides being made in our intestinal tract, is found mostly in dark green leafy vegetables. If you are being treated with any medications to thin your blood, it is not necessary to avoid vitamin K-rich foods, but it is very important to keep your dietary sources of vitamin K consistent from day to day. This should be discussed with your healthcare provider, who may be carefully monitoring doses of these blood-thinning medications called warfarin or Coumadin. Vitamin E supplements may also affect this condition. How do you begin to decide if you need a supplement? One suggestion is to keep a food diary or log for 2 or 3 days of your usual food intake. Look for the food groups and nutrients that you might be missing on a daily basis, and then consider healthful foods to help fill in the gaps. For example, substitute that afternoon snack of chips for an orange and a handful of almonds or a box of raisins. Or if you are running out the door in the morning with just some coffee and toast, consider adding a cup of yogurt for a calcium and protein boost, or instead of spreading your toast with butter or margarine, try peanut butter for more protein, potassium, vitamin E, and other nutrients. It is that easy. If after trying to fill in the gaps with healthy food, you still find it difficult to maintain adequate intake of vitamins and minerals through your diet, discuss this with your healthcare provider. Again, a multivitamin and mineral supplement commonly found in most stores may be a great safety net for you. However, other supplements, such as fish oil and omega-3 fatty acids, may also be recommended for heart disease risk reduction. And it is always a good idea to discuss supplements as well as any other over-the-counter remedies or medications with your pharmacist, especially if you are already taking any prescription medications, to find out about any possible interactions. In summary, vitamin and mineral supplementation can often be helpful, especially for those with increased needs. Be aware of what you might need for your health and well-being, as well as reasons for possible increased or changing nutrition needs. Know as much as you can about what vitamins and minerals do for your body and how they affect your health, and be sure to discuss supplement use with your doctor, registered dietitian, and pharmacist, especially if you are being treated for any medical conditions.
This has been another presentation by My Weight World.